Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're diving deep into a legal showdown that could redefine public health policy and test the boundaries of administrative law. 6 major medical organizations and a pregnant physician are suing Health and Human Services Secretary Robert F. Kennedy Jr. over his unilateral decision to remove COVID-19 vaccine recommendations for pregnant people and children. If you care about vaccines, public health integrity, or frankly, how the law checks government power, this is an episode you'll want to stick with. So what is this lawsuit about? Well, the lawsuit, entitled American Academy of Pediatrics versus Robert F. Kennedy Jr., was filed in federal court in Massachusetts on July 7th. The plaintiffs include some of the most trusted voices in medicine: the American Academy of Pediatrics, the American College of Physicians, the American Public Health Association, the Infectious Diseases Society of America, the Massachusetts Public Health Association, the Society for Maternal Fetal Medicine, and notably, a pregnant physician from Massachusetts, proceeding anonymously as Jane Doe. They're suing RFK Jr., acting as HHS Secretary, because he directed the CDC to remove routine COVID-19 vaccine recommendations for healthy children and pregnant women without going through the proper scientific and procedural channels. Specifically, he bypassed the Advisory Committee on Immunization Practices, or ACIP, which has long guided these decisions. Now, we spoke at length on this podcast about ACIP. Why does this matter? Because when you skip over the scientific advisory bodies and established processes, you don't just violate norms, you can violate the law. That's exactly the argument being made here by the plaintiffs. The plaintiffs aren't just asking the court to slap Kennedy on the wrist. They want robust judicial intervention. They're seeking 2 key forms of relief. First, a preliminary injunction. This is a court order issued early in a case that temporarily blocks a government action, in this case, Kennedy's directive, while the court fully considers the lawsuit. To get a preliminary injunction, the plaintiffs need to show that they're likely to succeed on the merits of their case, that they'll suffer irreparable harm without the injunction, and that the balance of equities tips in their favor and that the public interest supports it. Second, they want a permanent injunction, which would permanently bar Kennedy from implementing or enforcing this directive if the court ultimately finds it unlawful. They're also asking for a declaratory judgment, which is the court formally declaring that Kennedy's actions were unlawful, specifically that his directive was arbitrary, capricious, and an abuse of discretion or otherwise not in accordance with the law. That's the language of the Administrative Procedure Act, the federal law that governs how agencies make rules and decisions. In short, the plaintiffs want the court to stop Kennedy, reverse the policy, and reassert the rule of law over public health policy. Now let's talk about standing, a threshold issue in every lawsuit brought. Standing means that the plaintiffs have to show that they've been directly harmed by Kennedy's directive, not just that they disagree with it or they think it's bad policy. Here, the plaintiffs make a compelling case. The pregnant physician, Jane Doe, argues that because of her job in a hospital where she faces high exposure to infectious diseases, the removal of the COVID-19 vaccine recommendation directly threatens her health and her pregnancy. That's a concrete, particularized harm. The medical organizations argue that Kennedy's directive undermines their ability to provide evidence-based care, particularly in obstetrics and pediatrics. Their members are already facing increased patient confusion, hesitancy, and misinformation, all of which impedes their professional duties. That's classic organizational standing, when an action directly impairs an organization's mission or the ability of its members to do their jobs. Courts are more likely to recognize standing. Plus, filing in Massachusetts is not random. The plaintiffs point out that the pregnant physician lives and works there, and the other direct harms have emerged in that state specifically. That satisfies the venue and personal jurisdiction requirements under the law. Beyond standing, the case is a test of administrative law principles, particularly under the Administrative Procedure Act, or APA. The APA exists to prevent federal agencies from making arbitrary decisions. It requires that policy changes be made transparently, with proper notice, expert input, and a rational basis. By bypassing ACIP, dismissing all its members, and rewriting federal vaccine guidance with no clear evidence base, that's what plaintiffs call a textbook APA violation. But there's also the public health angle. Without a clear, science-based federal recommendation, we risk further erosion of vaccine confidence, not just for COVID-19, but for every vaccine on the schedule. As Dr. Tina Tan from the Infectious Disease Societies of America said, it is unconscionable to take away a parent's ability to protect their child through vaccination. And beyond the APA, this case could clarify how much unilateral power an HHS secretary has over public health guidance, and whether that power can be used to implement personal ideology over scientific consensus. So, to wrap up, this lawsuit is about COVID-19 vaccines on the surface, but underneath, it's a referendum on how we govern health policy in the United States. Thanks for sticking with me so far on a very legal, in-depth topic. If the plaintiffs succeed, we will see a strong reaffirmation that public health decisions must follow legal procedures and scientific rigor. If they fail, well, the door could open wider for future secretaries to reshape vaccine policy based on politics, not evidence. We'll be watching the court's response closely, particularly any decision on the preliminary injunction, which could come quickly given the urgency of the health risks. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.